MSU Extension State Health Specialist, back with you in our series of conversations about COVID-19. Today I'm joined by my colleague, Dr. Julie Parker. Julie, thanks for joining us.
Thank you, David. I appreciate the opportunity.
Well, would you tell our listeners and viewers a little bit about your background and what you do?
Sure. So I'm an associate professor in the School of Human Sciences, and I'm also a certified child life specialist. In my role previously as a practitioner in child life, I worked specifically with children and families within the context of a healthcare system, addressing psychosocial and developmental issues of children who are in healthcare. As a faculty member, I not only teach uh, classes that actually address psychosocial and developmental care, but I also work with other service providers who are working within the context of early intervention and child life.
Well, there's probably not a more important time for this content and these skills than now, with all the disruption in society. Kids are hearing all about COVID-19, and I know for my children, they're feeling the pressure of being away from their friends, their disrupted schedules. Parents have got testy tempers. Not speaking for myself, but just kidding. But testy tempers and other challenges. How can we best help our kids navigate these difficult times?
Well, you're right, David. It's really uncertain for everyone, and especially for young children. What we see in very young children, which is my area of specialty, is children birth to 5, is that we see their uncertainty coming out through their play behaviors. We also see their uncertainty coming out through regression. So, skills and behaviors that they had previously mastered, they may have regressed in some of those areas. So, they may have to go back to, you know, having bathroom accidents. They may go back to sucking a pacifier or a thumb or something that they feel is comforting for them. So regressive behaviors are not unusual when very young children are trying to process the stress that they're encountering. We also recognize that helping them through these stressful times is a really important component to what we do as the caregiver. And so making sure that we're doing our own self-care is important so that we can alleviate kind of the stressful atmosphere in our environments, potentially our homes, so that children do recognize that we are not only there to help them on a daily basis, but to also answer their questions and to try to provide the reassurance that will be comforting to them to potentially lower their stress level and their uncertainty about what's going on in their current environment.
Well, I'm filing that away. I've got a 4-year-old here in my house, in addition to my 10-year-old and 8-year-old. So that will be useful for my wife and me as we think about how to continue navigating this time with our 4-year-old. If we can, let's talk specifically about communicating with children about illness when it happens to someone close to them. Now COVID-19 is top of mind for so many people, but children in general are a lot of children at least are going to come in contact with a family member who's been ill. What's different about that from generally helping them navigate the larger social challenges related to COVID-19 that we've already talked about?
Right, right. So what we recognize is that illness in and of itself prompts uncertainty for all of us, but specifically for very young children, and it's dependent upon their age. As you noted, you have a variety of ages within the context of your house. And so the way information is delivered to even your children would be quite different. But we recognize that regardless, with very young children specifically, that stress is a very real thing. But what we also recognize is they don't always process information the way older children and adults do. And so therefore, we really have to meet them on their developmental level so that we can help to deliver information that's more developmentally appropriate for them and that allows them to understand the process that we're currently in. It's really important that we help younger children process these kind of information in regard to illness by answering their questions on a level, again, that's developmentally appropriate for them, but then also as honestly as possible. There's a lot of times that as the caregiver or as the parent, we don't always have the answer for the child's question. And it's okay for us to say that and just say, that's a very good question. And I can understand why you're asking that question or why you have that concern. I'm not really sure exactly how to answer it, but I tell you what we'll do is we'll find out the answer together, or we'll work on answering it together. So honesty is a really important component to being truthful in situations that are uncertain. And children are very perceptive, and so they know um, potentially we're not being truthful with them as well. Um, as we help them process their information, we also want to make sure that we are doing so in ways and with materials that help them feel safe. And so, through play is a great opportunity to just engage with them, for them to have kind of a medium to play out their feelings and potentially their frustrations and then also their stresses in a way that they really do understand how to process. And play is a great way for them to process what they're experiencing.
Well, super. So in addition to what you've already said, are there any actual steps you would suggest? I mean, like real concrete things that you'd suggest we take as we help our children?
Yeah. So, yeah, there are some things that we can be very mindful about as caregivers. One thing is daily routines. Now, we recognize that our daily routines have become extraordinarily different than what we are accustomed to. And so we're not getting up, having the same daily routine every day, going to work or taking our children to school, or even being able to go out to the parks as much as we would like and see our friends. So we have to get back into a routine that feels comfortable to us as well as to them. And when we do set that routine, then we have to maintain it to the best of our ability. And even though these are uncertain periods for us, that routine is essential for children because that's what gives them that confidence and security of, I kind of know what's coming next. We are going to maybe take a walk every morning at 10, and then we're going to come back. Not that they process it's 10 o'clock, but they know it's their walk in the
Right.
morning, and they're going to come back and maybe have a snack. Maybe they still take a nap in the middle of the day. And so those kind of routines really are helpful to children to maintain regulation and to process what's going to happen next in their life. So daily routines are important. Play, I've already mentioned play before, but play is children's work. That's how children
Mhm.
learn. That's how they communicate their needs oftentimes. That's how they communicate specifically their stresses. As a child life professional, we use play to not only teach children about their healthcare experience and the healthcare experience of others, but we also use play to assess and examine their process skills, how they were processing that information, and then how we needed to kind of circle back around and offer some additional explanations about some of their concerns or their misconceptions. We also can read different books about illness or about uncertainty. There's a great book out there now about how my city looks differently. And children notice that. They notice that everywhere they look, potentially someone has a mask on. That's not something we're used to. That's
Mhm.
not something they're used to. They also recognize that they haven't had any play dates lately. They can't see their friends and go to school or go to the park or even have someone over to their home. So all of those things can be very stressful, but if we try to normalize them in ways of maintaining their daily schedule, offering play opportunities. I think our children are already very savvy when it comes to technology. You can already see toddlers, they know how to go to an iPad and punch a button to get their favorite YouTube video to play. And so they have that unique characteristic already. And so incorporating things like FaceTime opportunities with their friends or opportunities with extended family, those can all be very comforting to some young children as well. We don't want to push screen time too much, but we do want to have it as an opportunity to make connections that they have lost at this point. We've talked a little bit about being truthful already and being honest, but providing as much information on their developmental level as we can in a very truthful manner so that we recognize that we may not have all the answers for them, but we're answering their questions to the best that we can in regard to if they're worried about the virus and will I get the virus? And
Mhm.
we have to say things along the lines of, we're going to do everything we can to protect our family from not getting the virus. And here's the things that we're going to do together. We're going to make sure that we wash our hands. We're going to make sure that we practice social distancing and explain that new concept to them as well too. We're going to make sure if we have a cough, we're going to cough into our elbow or our clothing or something that's going to catch that cough and not spread it. So all of those practices that we know we've been told that are important, we have to share that as a family with our children. And then, also just making sure that we go about our day in a way that lessens the stress level in our home. So making sure that if we are experiencing stress as the caregiver, that we do some things again that are um, helpful to who we are as an individual so that we can be better caregivers to our children.
Those are very helpful. We're certainly going to share those with our viewers after this video. It's made me think about sharing the strategies that we want to use for preventing COVID-19 with our children. I have found, just in hearing what you said and reflecting on that, I found that for my 4-year-old in particular, she's caught on to that, and it seems like it makes her feel like she's a part of the solution. And I think that's been really helpful for her. She's kind of even taken somewhat of a, at a 4-year-old level, a leadership role in our family of reminding us to wash our hands. And when we go, out to, we've been to the Noxubee Refuge, for instance, and she's reminded us before we got out of the car, we have to stay 6 feet away from people. So she feels like she got some ownership in this. And I think that's been really helpful for her in processing this. Of course, at a 4-year-old level, she just wants to be in charge. And there's some of that going on too. What other resources do you have that we should pass along to our viewers as we share this material and these steps and tips you've provided already?
Right. So we have a brand new extension publication coming out in the next week or two that actually covers a lot of this information that we just talked about. It's tips for young children, tips for parents in discussing illness and uncertainty with young children. So we'll have that posted to the extension website and then available on some other outlets as well too.
Okay.
So that'll be available for folks to look at and to review and to potentially have as a resource. There are other resources out there. I think many of our healthcare institutions have done a great job at pushing some information out for families who have very young children that are helpful as well too. So there are some different resources out there, but the tip sheet will be out in just a couple of weeks, if not before.
Okay, excellent. Well, we'll try to go back in and tag that with this post when it's ready. In addition to anything else that we find that would be helpful for our viewers. So we'll definitely get all that posted. Before we sign off, though, I wonder if there's any particular, maybe 2 or 3 kind of key points that you'd like for our viewers to remember about the things you've shared today.
Right. So, well, I think just as a recap, the important thing is to recognize that all young children are curious and that they all have different levels of misconceptions and or uncertainty about the current situation, and then situations of just illness in and of itself. And so addressing them really from an individual perspective, one child may need a bit more information than the next child needs. And so understanding that as the caregiver, as the parent, we can individualize our delivery of information to really specifically what will satisfy not only their need for information, but help to calm some of their uncertainty as well too. The the second thing that I would recommend is that making sure that children have lots of great play outlets is so important. Offering them opportunities, and we've had such nice weather here recently, being able to get outside and do some play activities, helping them work through some of their kind of pent up energies in those areas helps as well too. And then also the third thing is, I think that's very important, is our own self-care so that we can be the best caregiver we can be for our children and for those that we are caring for. So when we feel those levels of frustration going up, what is it that we need to do to really kind of get ourselves back in the right space so that children see that, even though we may have a concern, that we can handle that concern, and that we can do things that are very helpful and supportive to not only ourselves but to others as well.
Julie, thank you so much. And thank you, viewers, for joining us today. I hope some of these tips are helpful for you as you continue to navigate this challenging time with your children. And if you don't have children, you can share them with someone around you who does. Feel free to leave a comment for us in our chat box below, in the comment box below, about what was helpful to you today. Maybe if there was anything that was unclear, you want more information on, certainly use that as a way to ask for additional information and help. And always feel free to leave us suggestions for other topics that we can cover that would help you navigate this COVID-19 crisis and this challenging time that we're all facing. We really, again, appreciate you joining us. And as always, I encourage you to stay vigilant and stay healthy.